obviously don't want that to happen.
Right. So thank you for that. So let's go back to our, PowerPoint. And next thing we're going to be looking at is our three systems. So I touched on that a little bit earlier, and I touched on that we're going to be talking in our review about what our three systems are. And that's kind of critical, because when Kelly's telling me that she doesn't like the balance exercises, it's really what she's saying is she doesn't like what it's doing to her balance systems, that it's challenging those balance systems. So what balance, again, is the coordination of multiple systems that the brain then synthesizes that information in determining your current position and joint space and where you're at. And the brain uses three main sensory inputs to help evaluate your current standing posture, head position, acceleration, deceleration, or change of direction. So the brain is an amazing processing organ that can take a whole bunch of these systems, bring them together to figure out what's happening, and then make that change, whether it's consciously or subconsciously. Like a reflex would be a subconscious change. So overall, the brain controls your ability to maintain your balance in three main ways. So it senses your current ability, your current level of stability. So it's constantly sensing where it's at. It synthesizes information from multiple inputs. And then it makes the needed adjustments. So again, it maintains your balance in three ways. It senses your current level of stability. So that's you standing there, all of a sudden realize, ooh, I'm tipping this way. So it starts to synthesize all information, everything that's telling my inner ear, my eyes, my joint space, my sensory inputs are now hitting the brain, telling me that I'm leaning, I'm falling over. So it synthesizes that, and then it makes those adjustments. Oh, lean forward, pull here, move here, get my head up right, stand up, get erect. So all of that is processing very, very rapidly in the brain, and from multiple systems, not just one. And that's why you see an individual that's had a stroke that has damaged part of their brain that controls balance. It's hard for them to make those adjustments. They constantly lean off to the side, that they can't respond quickly because there's part of that brain that makes those adjustments, that process that information is damaged. So let's go through our three balance systems. And this will help explain, especially for Kelly, why we're getting some challenges, some difficulty with the tests but the exercises that I have you do in the virtual personal training program. So our number one primary balance system is your vision. And that's easy to see. I mean, you could see that as soon as I tip my head here, I could tell that where I'm going. I could tell where I'm going backwards. I can immediately see literally the change that's happening with my balance. But have you ever felt unsteady in a dark room, or walk into your car in a dark parking lot? Or how about when I have you close your eyes when you're doing your balance stuff down in the training facility? So when your eyes are open, your vision is continuously sending information to your brain, just continuously. And it's related to where you are in relation to your environment. And then your brain constantly processes that visual input very rapidly. It goes in your eye, boom, goes right to your brain. Right from your eye, you see it goes poof, right into that optic nerve, straight into the brain. And that's where it's going to the processing centers of the brain that starts telling you what you're seeing. But have you ever noticed that you could turn your head rapidly, and as soon as you turn your head, your eyes are already fixated on what you're looking at? You know, a book slams, something slams, you whip your head over and you look, and you instantly can see. There's no delay. And that's because there is an ocular brain reflex. So from the inner ear, ocular vestibular reflex that goes from the inner ear to the eye. So as the body turns and it senses that it's turning to the head, it takes your eyes as a reflex and whoosh, turns it the exact same direction that you're looking. So as soon as you turn your head, you're already fixated on it. There's no delay in your vision to your ear, in your inner ear. So again, your vision is a primary processing. It is your number one. It is your absolute. And that's why once we make you close your eyes, you're going, whoa, whoa, I hate this. What are you doing? I can't do this. Because the vision is your primary. It's everything. You're getting immediate, instant feedback. And a lot of your reflexes are tied to that vision. Like I said, the vestibular ocular reflex, it's right there. It happens. It does it for you. You don't even have to think about it. Okay. The second system is sensation. So the second balance system, it really involves a few types of sensation. It's not just sensation overall. The most basic kind of sensation is through the skin along the bottom of your feet. So think about this. As you're standing there, you're shifting your weight forward to back. Well, why is it forward to back? Because as you shift your weight, you can feel the pressure shifting, which tells your brain your body weight position concerning your base of support. So while you're standing there, you will sway forward, which then puts more pressure on your forefoot, your toes and the pad of your forefoot. And as soon as it gets too much pressure, your brain says, whoop, too much there. We're going to fall on our face. So what does it tell you to do? Lift up your toes, which by lifting up your toes, it rocks you onto your heels. As you rock onto your heels start getting more pressure into it. So if you get too much pressure in it, your body says, I'm going to fall on my back. So then it tells it, push down with your toes, which sends you more forward. So when we're standing there, it's really this constant sway, back and forth sway when we're standing still in just a stationary position, solely from the skin at the bottom of the feet. So we can all imagine what's going to happen if you have diabetes and you have diabetic or peripheral neuropathy. You have no sensation to the bottom of your feet. What does that mean? Are you going to get that feedback back to the brain on pressure? Nope. So does that mean you're going to spend all day falling? No, but that's one of your systems. So your vision is your primary. This feet at the bottom of your feet, that's another system. That's your sensory system. That's that sensation. So if you do have a diabetic neuropathy and you're lacking sensation or it's completely numb, it does increase your chance of falling because you can't always feel the pressure on the bottom of your feet and give you proper feedback. Okay. The other factor in sensation has to do with proprioceptors. So your body has different receptors that are in your joints and in the muscles, which again are called proprioceptors, and that's just joint awareness. And these receptors give your brain more information about the overall body position in space. So proprioceptors are Golgi tendon organs, which are in the tendons of the muscle. These muscle spindles, which are in the muscle fibers themselves. And when they are stretched, it sends immediate feedback back to the brain. Sometimes it doesn't even go to the brain. It just goes to the spinal cord. And once it hits the spinal cord, it sends it immediate back. It doesn't even take it back to the brain. It sends it right back to the muscle and says, fire. And I'll give you an example. How many times have you been at the doctor or anywhere and they break out the little reflex hammer and you're sitting there and they go tap right on your knee. And what does your knee do? Boop, boop. Your knee kicks out, correct? That is a test of your reflexes, which is your muscle spindles, your Golgi tendons. By hitting your tendon, it creates a rapid change in direction from hitting that tendon, which then tells the muscle, you've just stretched a ton really quick, which means there's a chance you might fall. There's a chance you might tip over. So it tells the muscle, it goes right back to the spine and right back to the muscle and says, fire. It doesn't even tell the brain, you need to fire. It just says, we know it needs to fire. And that's why without you thinking about it, a doctor taps there and then your knee kicks out and you're like, I didn't even control that. That just did it on its own. That's the proprioceptive system. Okay. but that's part of that sensation system. So just know that, again, you have vision as one, then sensation is the other, which is your feet, but also the little receptors in your joints and your muscles that tells you where you're at in space. If I close my eyes and I put my arm out over here, how do I know my arm's over here? If I said, here, look right in front of you, I'm going to hold this stick. Close your eyes. Now grab the stick. You can close it and you can visualize where that is, and you can grab it even without your eyes, because you're getting all that feedback, those proprioceptive feedback from the joints and the muscles. Okay. So this takes us to our third system, which is the inner ear. So John had mentioned the Meniere's having a decrease in inner ear, and it just totally messed him up for a while. So the vestibular system is your third system. And this involves fluid that's in that inner ear. And there's 3 semicircular canals that are in the inner ear. And if you've ever seen it, it looks like a little conch shell, a little circular spiral shell. And essentially the way this works is that you have sound that will come in, and this is how you hear, and it hits that tympanic membrane, which vibrates these bones, that goes to the inner ear and can send feedback to the brain so you can hear. So that's what this one is right here. See this little curly, correct? Do we see that? Is that too hard to see? Let me see if I can make it bigger. Is that better, Lisa? Good. So that inner ear, this one here, that's what you hear from. So that's where you're getting, listening to my awesomeness right now is because of, because that inner ear. That's not what we're talking about. We're actually that's part of the inner ear, but we're talking about, see these little canals that are on the top, these semicircular canals, those are the ones we're talking about. So those are directly related to acceleration, deceleration, and rotational movement. So inside those little semicircular canals it's all fluid. And in the fluid are these little hair cells that the hair cells stick up, and on the top of the hair cell is a little crystal or a little rock. And the whole purpose of that rock is so that as I turn my head, that fluid then lags behind, and that fluid lags and pushes those crystals that are on top of the hair cells, and they bend the hair cell. And by bending the hair cell in a certain direction, because if I go that way, it's going to bend them backwards, which then those hair cells come down and connect to my vestibular nerve, which is right here. So you can see them all attaching. And it goes on that vestibular nerve back to my brain and says, you're accelerating, you're decelerating, your head's rotating right, it's rotating left. And that's what's connected to the vestibular ocular nerve, so that as I turn my head, my eyes already have a gaze that's fixed. Is this necessary for you to understand this to improve your balance? No. But the whole point, the big message that I want you to understand with the balance system of the inner ear is that it helps control body position, head position, rotation, acceleration, deacceleration. So it's definitely one of your processing. But let me tell you this, out of your vision, out of your sensation, this is the slowest. It's slow. So you don't always get the feedback quick enough. And that is why when Kelly is on her doing her balance exercises and I ask her to close her eyes, she's like, this isn't possible. Because now it relies on the sensation of the feet and the inner ear, which are slower processors than vision. Vision's a primary processor. So the take-home message here, your brain is continuously working to interpret information from multiple systems, your vision, your inner ear, the sensation of your feet, and your joint receptors. And it makes that adjustment that's necessary to maintain the stability of your body. If one of these 3 systems are compromised, instability can occur. So we mentioned that if you have peripheral neuropathy to your feet, you can't feel your feet, that can affect your balance. And now you know why. But what if you're Lisa and you had cataract surgery